Doctors of Reddit, what is a 1 in a million chance thing about your patient you have witnessed? My father is an anesthetist. I remember his 1 in a million, way more rare actually, thing happened when I was like 13. He was knocking a patient out for the surgery, did the pre-op stuff. The woman's consultation earlier showed no flags for anything major. She had a reaction, which can happen such as malignant hypothermia, but this wasn't that. Her reaction to the medication was where her own skin started to split and peel away from her body in large chunks. Her own body was rejecting her skin. The woman spent quite some time recovering. There was an investigation into the whole thing, but everything was done by the book and there was no reason for this to happen. The drug company was contacted, and they had never heard or seen about this happening with any of the drugs. Drugs were taken and retested. This went on for a while. Turns out it was an allergic reaction to the drug and it's just the way it presented. It was so extremely rare no one had seen it with the drug that has been in use for decades all over the world. My father ended up writing a paper on it. One of my patients nearly died from an amniotic embolism while she was in labor. It's so rare that the only way to diagnose it is by ruling pretty much everything else out first. It's essentially when the amniotic fluid accidentally passes into the mum's bloodstream. She had a cardiac arrest and we did CPR while doing an emergency C-section. She is slowly recovering, but has lost most of her brain function. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated, and it was distended. No drainage per catheter. When we pulled the catheter out, there it was, a worm which got stuck inside the tube. How the hell did the worm enter the bladder? I was a paramedic, and I came to a scene where I had a patient who was talking to me, but he had no blood pressure and no detectable pulse. I couldn't even hear his heartbeat with a high quality stethoscope. They dumped a few bags of fluid in him and the ED before they were barely able to get a BP on him. This was years ago. Saw a teenager, 16 or 17, have a heart attack. Jacked athletic kid with 8-pack abs fell on the ground clutching his chest during basketball practice. Everyone in the pediatric ER thought it was a panic attack except for the adult ER resident who said, "I've seen hundreds of heart attacks. He's having a heart attack. Don't ask me why, but that's what this looks like." And that's what it was. He had an inborn anomaly where one of coronary arteries coursed between the pulmonary artery and the aorta. During exercise, the aorta and pulmonary artery expand with the increased cardiac output, and for whatever reason, that was the day that they squeezed a right coronary artery and caused a massive myocardial infarction. It was bad news bears. The damage was so bad, kid needed a heart transplant. He was transferred to a pediatric heart center. A left ventricular assist device, LVAD, was implanted because his heart function was so poor. A donor heart was found, and as he was being prepared for surgery, his own heart decided to suddenly start working again. It turns out that hearts can heal after a massive heart attack, especially teenage hearts in athletic kids. This was only discovered after the advent of the LVAD, because prior to that, nobody would live long enough to recover. At the time, I think this kid was like one of the first 10 pediatric patients to get an LVAD at that hospital. So the kid had to get his coronary artery reimplanted so that it wasn't going to get squeezed like that again, but he got to keep his heart, and I hear he recovered and returned to playing basketball. Had a very sick child with influenza. Spent 6 months in my ICU, had a month of blood gases that were not compatible with life. Had multiple collapsed lungs. He's currently in 6th grade, no ventilator, no tracheostomy, literally no complications for the long term. Story from last year. After a pretty uneventful pregnancy, a woman goes into labor, but it doesn't advance as quickly as it should, so she gets a secondary cesarean section. Standard procedure. The baby gets out, and its eyeball is almost pressed out of the eye socket. Everybody is in shock. The parents start crying. We don't know what to do. Turns out the child had a huge tumor of the temporal lobe which pushed the eye out. We later analyzed the ultrasound pics and the tumor was already there, so it just got overlooked. Brain tumors in neonates are even rarer than 1 in a million. It's actually 0.3 per million, so I hope I'll never see such a case again. Edit. Unfortunately I don't know the outcome. The child was transferred to another hospital. I once saw an fourth drug user who managed to break an old needle off in his vein when injecting, and presented with chest pain. It was only when we were doing an angiogram we noticed the needle fragment embedded in his heart. I've never seen this before or since. TLDR, needle inside the heart in a drug user, couldn't get it out. Bad situation. I once saw a newborn baby who was a true mix of genders, intersex. I was part of the meeting with the top pediatricians discussing the case. The patient's gender was clinically indeterminate from external genitalia. MRI showed one ovary and half a uterus on one side and a partially descended testicle on the other side. To decide once and for all they used genetic analysis to analyze the chromosal makeup. However, this showed a 50-50 mosaic of cells, some of which were XX, female, and some of which were XY, male. A very confusing case as to what to do next. Unfortunately, I was unable to follow this one up. Edit. Terminology. I wrote the post quicker than I should have, and do not work in this field. Apologies for any offense. My mother, now retired, was a GP in the middle of nowhere, in southwest France. In the early 90s, she had her first HIV cases. With the med at the time, they did not last long. Except one. Clearly HIV, but not developing AIDS at all. He was one of the few people with natural immunity. I had to tell a 104-year-old patient that he was only the third oldest patient on the ward. He was really disappointed. Had a patient come in with headaches, and she was a young woman. Her entire body would go numb with these headaches. Got her caught. She has 3 separate tumors in her brain. My aunt and uncle-in-law are both doctors. Once, she was lying on his stomach, and she heard something odd in his pulse/blood flow. Went to the hospital that night, and he had surgery to resolve an blockage which, if it had ruptured, he would have been dead in 10 minutes. All by pure chance. I'm not a doctor but an RN. Before I was an RN, I was a patient care technician in the emergency department. I often worked closely with a specific doctor. She had a habit of thinking that there was always more to symptoms than there were, so no one ever took her seriously when she went digging. She especially paid close attention to pediatric patients and ordered way more tests than any of the other ED physicians would have. There was a 12-year-old boy whose parents brought him in for suicidal and homicidal ideation. The child talked about how he hated himself, wanted to die, suddenly hated his parents and siblings and often thought of hurting them. He had no history before this of being mentally ill, and it happened very suddenly. Within a week his personality changed. His parents were absolutely certain that it was just him being a preteen, hormonal and unstable. All the things he described were typical of a depressed and mentally disturbed preteen, and none of us thought anything otherwise. We assumed he was suffering from mental illness. However, when the doctor spoke to him, he vaguely mentioned having frequent headaches and getting dizzy a lot. He and his parents also talked about how he had started complaining of nausea and would sometimes vomit for no apparent reason. She thought that he may have something organic and not just mental going on. She got a CT on his brain. I remember the nurses saying she was overreacting and that the kid should just have a psych consult and be hospitalized. I very distinctly remember people complaining about doing more work than necessary on this child, who was obviously just mentally disturbed. It turns out, the kid actually had an atypical teratoid rhabdoid tumor, ATRT, which is incredibly rare, less than 1% of childhood brain tumors. The tumor had been there long enough to spread to his frontal lobe. On further questioning, after he was diagnosed with the ATRT, the child had been complaining of dizziness, vomiting and headaches long before the personality changes, but it was attributed to him being overweight and having ADHD. It's honestly amazing that the child lived long enough with this tumor for it to spread so far, as it's such an aggressive tumor and generally, children don't live long with them, especially if they're growing at that rate. It's a rare brain tumor, and even more rare, that a patient lives long enough for it to spread and cause personality changes. I will never forget that a doctor always looked further into things than people thought necessary. If any other doctor had been on that day, the kid would have been referred to psych, hospitalized in a psych institute and dead in weeks without his parents knowing it was all due to a tumor, until after an autopsy. After a neuroconsult, he was shipped to Boston's Children for his brain surgery, one of the top places in the US for pediatric neurosurgeries, and he is alive to this day. He has to have therapies to help him learn how to live normally again. But if it weren't for that specific doctor being on, he'd be dead right now. Eventually, he will live a normal and long healthy life. That really taught me to respect a doctor's knowledge more, especially if it seems like their intentions are good. Trust the physicians you work with and trust that they are ordering those extra tests, not just to save their own, but because they want to save lives and are concerned about their patients. I would say I have seen 2 cases of this. The first one was a dude who got stabbed in the chest. He arrived at the ER and had the knife moving with his heartbeat, but he was actually stable, in pain but stable. We got him to the OR, and to my surprise the knife went into the heart, but was about 1mm from going into the inner cavities, so he was saved by 1mm from probably dying. X-ray. The second one was a young man who got shot in the back. He came in the ER with pain but very stable. He went to a CT scan, and the image was just incredible. It's not simple to explain without an image, or if you're not used to seeing CT scans, but the bullet went in through his back, missed the right kidney, liver, the spine, and ended between his aorta and cava. It was just the perfect trajectory to miss everything. 1mm in every direction. Could have been fatal. I couldn't believe that, haha. This is a random image I found, and in red is the trajectory the bullet had. I'm a vet. It wasn't the patient so much as the owners. A dog was brought in because it was giving birth. The only thing was that it was male. The woman, late 30, was screaming that she sees the head. In reality those were his testicles. In the end I had to sit and explain to her about the birds and the bees. During my residency, I worked in a unit which did a lot of urology. We had a series of regular patients with urethral strictures, narrowing of the urinary passage, and they used to visit from time to time to get their strictures dilated. These veterans would eventually learn how to catheterize themselves. One of the patients, a young boy of 14 whose original injury had been a pelvic fracture in a road traffic accident, came to the ER on a Saturday in considerable discomfort. I was on call and asked him what happened. I passed this catheter in, and I can't get it out. What he was using wasn't really a conventional urinary catheter which has a balloon at the tip to keep it in place that can sometimes get stuck if the channel to deflate the balloon gets clogged. But that was not the problem here. He was using an infant feeding tube because the conventional catheters were too big for his narrow passage. The feeding tube is just a simple tube with no swellings and no mechanism to retain itself in the bladder, so I didn't really believe him. However, I found that he was right. I couldn't get the catheter out either. The catheter was fitting so snugly in the stricture that he couldn't pass urine and his bladder had filled up like a balloon about to burst. We took him to the OR and did a suprapubic cystostomy, basically made an opening into the bladder from the abdomen. This relieved the pressure in the bladder. Next we passed a scope down the SBC and found that the feeding tube that he had used as a catheter had gone into the bladder and got knotted around itself. Every time we tugged on it, the knot was getting tighter. We had to cut it off below the knot to get the rest of the catheter out. We got the knot out from the SBC. ER nurse. We give an antibiotic called Rocephin very frequently for patients diagnosed with a UTI. The only complication I've ever seen from it is vomiting if it's pushed too fast. I had a patient transferred to me from our urgent care side who had walked in fairly healthy but complaining of UTI symptoms. They had tested his urine, diagnosed him with the UTI, given Rocephin, and were planning on discharging him home with oral antibiotics. We still don't know completely what happened, but this is our best guess. We think he had a gram-negative infection that reacted to the Rocephin by lysing. The bacteria essentially exploded and raced through his body, putting him into almost instant septic shock. He had to be intubated and put on blood pressure medications to keep his BP high enough to perfuse his organs. His temp went from 98.6 to 104 in under an hour. A central line was placed because we kept running out of IVs to give medications. He was transferred to an ICU. I have never before visited a patient of mine in the ICU, but because of his drastic decline, I had to see him and know how he was doing. I cleared it with the ICU charge and visited him 2 days later. He was extubated and walking almost on his own. One of the fastest declines and recoveries I've ever seen.